regarding the safety of oral antiandrogenic drugs. One of the most frequently asked questions is if finasteride and dutasteride are unsafe drugs and produce sexual adverse effects. Well, the recently published meta-analysis have shown that these drugs are very well tolerated, and the risk of adverse effects is almost the same than placebo. So these are really safe drugs in the use of androgenetic alopecia. In second place, some patients ask us if is really any effective treatment for hair loss. And I always explain to the patients that first of all we have to properly diagnose the specific type of alopecia. And then after we should select the proper medical therapies. And of course there are a lot of effective medical therapies depending on the profile of the patient. We can select one treatment, topical, oral, or the other, but of course that there are many effective treatments for different types of alopecia. Yes, we have more than 100 types of alopecia. The most frequent one is androgenetic alopecia, followed by alopecia areata or telogen effluvium. But there is other huge group of alopecias called scarring alopecias, which are very trendy because we have currently the most frequent scarring alopecia is frontal fibrosing alopecia. It's like an epidemic and we don't know the exact cause, but we can say that for the majority of these alopecias we have effective treatment that can improve the hair density in our patients. Another frequently asked question is if the treatment should be maintained in the long term. It's a very important issue to discuss with the patient the first day of the consultation, because for androgenetic alopecia we don't have curative treatments, so the treatment that we are going to start should be maintained in the long term. It's not necessary to use it daily, but it's important that the patient needs to know that he or she needs to maintain this therapy in the long term. Well, another interesting question is regarding the role of dermocosmetics in the treatment of hair loss. I think that dermocosmetics can play an important role as an associated therapy in our patients with different types of alopecia, specifically androgenetic alopecia and telogen effluvium. And I have feel in my experience that when I prescribe these cosmetics, the patient feels an improvement, an early improvement that produces an improvement in the adherence of the medical therapy. So I think these dermocosmetics may help the patients to feel an early improvement that could improve the long-term compliance of the medical therapy. Well, regarding the specific types of dermocosmetics, we prescribe in some patients vitamins, shampoos, and specific topical dermocosmetics, and these dermocosmetics may improve the quality of the hair, and then the patients feel this early improvement that produce improvement in the adherence of the medical therapy. Regarding the types of dermocosmetics, we use vitamins, we use shampoos and some topical products for the hair that can improve the quality of the hair, and so the patients feel this early improvement that is going to also improve the compliance of the associated medical therapy. Another frequently asked question is if the hair transplant cure the alopecia. Many patients come to the consultation saying, "Doctor, I want to undergo a hair transplant because I'm bored of pills, of topical products." And this is a mistake, because hair transplant does not cure alopecia. So in every patient that we operate, we should prescribe the adequate medical therapy to maintain the rest of the non-transplanted hairs.